Horizontal cleavage meniscus tear treated with all-inside repair with bone marrow aspirate concentrate. Our case is a 43-year-old female from Bhutan who presented to our clinic with right knee pain. On physical examination, patient tested positive with McMurray test and joint line tenderness over at the medial side. Tests for ligamentous injury and knee instability are all negative. MRI showing a horizontal cleavage tear of the medial meniscus. The patient is placed in a supine, semilithotomy position with the ASIS exposed and prepared for bone marrow aspiration. Percutaneous release of the superficial MCL known as the magic point opens up the medial compartment. With the limb in full extension, palpate the posterior tibial shaft cortex until just before it flares up to form the posterior plateau and draw a straight line extending from posterior tibial cortex to the adductor tubercle. We call this line the TU line. The magic point is 2.8 cm distal to the adductor tubercle, 1.8 cm distal to the medial epicondyle, and 1.2 cm above the medial joint line on the TU line. Inspecting the medial meniscus show a large horizontal cleavage tear of the body. A diamond rasp is then used to debride the cleavage tear. Now that the medial compartment has opened up, we have more access to the body of the medial meniscus. Initial suture repair is done through passage of spectrum suture passer hook, capturing meniscocapsular tissue, reducing the cleavage tear. To easily repair the posteromedial portion of the meniscus, a first-pass mini-suture passer is used to access this corner. Repair is subsequently done spanning the whole length of the tear until the medial meniscus is inspected to be stable. If we had not released the magic point of the medial collateral ligament, this area of the medial meniscus is almost inaccessible. Bone marrow aspiration using the BMAC kit is done similarly how one would harvest an iliac bone graft. The harvesting needle is directed 45 degrees and 2 cm superior the ASIS. Good cancellous bone penetration is made sure with aspiration of a bright red color marrow aspirate using a 10 ml syringe. For this repair, 30 ml of bone marrow aspirate is collected. The BMA will be processed through a centrifuge. Once done, the process of cell separation will begin. allowing us to collect concentrated bone marrow aspirate. The repaired horizontal cleavage tear will then be infiltrated with the BMAC concentrate, providing stem cells and growth factor to an avascular region such as the white zone of the meniscus, allowing its potential to regenerate.